and I are the co-chairs of the Milwaukee Mental Health Task Force, and we are here to testify regarding the importance of maintaining the Medicaid funding that's in the budget and the safeguards that provides for people in our community with disabilities, and particularly with mental health issues and substance abuse disorders. The other area of importance that I talked about today is mental health services in our prison system, especially the juvenile facilities, Copper Lakes and Lincoln Hills, and maintaining funding for those, increasing funding, making sure that medications are being distributed properly by properly trained staff, and that there are enough mental health staff in the Department of Correction facilities to be providing adequate care, because there are often not.
And I spoke about MAP, which is a Medical Assistance Purchase Plan, which is a way to get Medicaid if you're returning to work or return to work. And right now there's a disincentive in the program if you earn more than 150% of the federal poverty level, and the program is being restructured so that it's affordable for those that are returning to are in the workforce. For people that are in disability, and is being restructured so that there's individuals that have some very severe disabilities that will be able to continue within the MAP program. And I talked about the children's long-term waiver, which 43% of the children have been on a waiting list for a long period of time. 2,200 children, as a matter of fact, that have developmental, physical, and emotional disabilities. So that is a very significant part of the budget this year.
Can you talk a little bit about the services they receive once they're on the waiver?
Well, the services they receive in the waiver program are services within the school system. Their mental health services, their services, I believe, it's not my full area of expertise. Things like physical therapy, I believe, and regular services through the Medicaid program. So it's a variety of services to keep them independent within the community.
And then a final issue that one of our colleagues spoke about that's really vital is transportation. That we want to encourage people to be in the workforce, and we want to help people be well and maintain recovery and not be in expensive institutions, and being able to get to doctor's appointments, get to work, get to job interviews is really vital, and the transportation system needs some help.
Another area that we spoke about was there's money in the governor's budget for a peer-run respite in Milwaukee for veterans. And a peer-run respite is a place for individuals that have mental health or substance abuse issues to go. It's a model that is run and operated by individuals themselves that have mental health or substance use issues. And it's not a medical model, and so it's in the governor's budget. And then the other item is housing, and there's some creative things in the budget for vouchers and waivers for people that are homeless to be able to be housed and get case management in an accelerated way and through waivers.